Aloha and welcome to the 16th meeting of the CRI for Red Hill. My name is Marty Townsend. I'm the acting chair. We were constituted by the Environmental Protection Agency in response to the November 2021 contamination of our water supply due to fuel released from the Red Hill fuel tanks. We're going to start the meeting with an Oli and then we'll do introductions.
Ola I kaha, ola I ka wai, ola I kai, Hawaii, Hawaii, Hawaii. Ola I kaha, ola I ka wai, ola I kai, Hawaii, Hawaii, Hawaii. Ola I kaha, ola I ka wai, ola I kai, Hawaii, Hawaii, Hawaii.
Mahalo. Okay, welcome everyone to our 16th meeting. We have a few substitutes for this meeting, in part because we all have personal emergencies and families and lives that we have to manage. So all the more reason to do introductions. So my name is Marty Townsend. I'm the acting chair for the Community Representation Initiative. I live in Kalihi and I am an at-large member to this body. And I'm just going to go around and call on the whole group. Helani?
Aloha, aloha mai kako o Helani Sonora Pale ko Uinoa. I am Helani Sonora Pale. I am the Kanaka Maoli CRI representative. Mahalo.
Mai Hall?
Aloha mai kātou. My name is Mai Hall. I am a Kanaka Maoli representative and an affected family member.
Ilima?
Aloha mai kākou. Mahalo to everyone who's here this evening. I'm Ilima DaCosta. I am an Oahu at-large member. Mahalo.
Mahalo. Mia?
Aloha, I'm Mielisa Otis. I'm representing the community. Mahalo.
Michelle?
Aloha, my name is Michelle Poplar. I am representing the community and substituting in as a community rep.
Thank you. Bill?
Yes, aloha, Bill South here. Yes, I'm a substitute this evening, but I've been very, shall we say, involved in this project and, outcome. So thank you, everybody, for letting me attend. I appreciate it.
Thank you very much. Natalia?
Aloha, Natalia Hussey-Burdick on behalf of the Sierra Club Community Organization.
Thanks. Kat?
Pat McClenahan. I'm an affected family member, and I'm subbing in tonight for Mandy Fine, who couldn't be here.
And Melody?
Hi, aloha. My name is Melody Aduha. I'm representing an organization, and that organization is the Environmental Caucus of the Democratic Party. Aloha.
Thank you very much. Did I miss anybody? If you are here, if you're not here, please raise your hand. Okay, I think I covered everybody who is serving on the Community Representation Initiative. And we will move on to our first agenda item. So we do have an actual vacancy on the CRI, and we have released an application to solicit people's information who are interested in serving. The link to the application is available in the agenda, which has been posted in the chat. The deadline to apply is February 26, 2025, and we hope to make a decision by March 5th. If you have any questions, you can email us at redhillcri@gmail.com. And the seat that is vacant is an at-large seat. So anyone who lives on Oahu, is a water drinker, can apply to participate in the CRI. Thank you very much. Okay, and I guess I should just say that the vacancy that we have is because Shannon Bentz had to leave. Because she also serves as a whistleblower. You know, she works for the military and was the fuel director at Red Hill, and she has a lot of really important background knowledge. But she also has these very strict rules that she has to follow as a whistleblower. And it turned out to be too difficult for her to both maintain a position as chair of the CRI and also comply with those whistleblower requirements. So she remains a friend of the CRI, but we do have to fill her seat with somebody who has more flexibility to be, to share information publicly. Okay, now moving on to agenda item 2, we wanted to debrief the December 12th meeting that was supposed to be with the Navy. Heleni, would you like to just introduce the topic and?
Sure. So we were at our last meeting last month, December, we had the December meeting was in the works and planned at least a month ahead of time. The date was decided upon by the EPA, the Navy, and the Red Hill CRI. We had to submit an agenda 2 weeks prior, and we went back and forth about the agenda. We did meet our new facilitator, who was hired by the Environmental Protection Agency, and we did work with her on the agenda. Up until the day of the meeting, we were expecting the Navy to finally be at the meeting. The last meeting they were at prior to that was in March of 2024. And we were very, I could say excited that we could finally ask some very pointed questions that the community really wanted answers for. And it wasn't until hours before the meeting started that we were informed that the US Navy and the Department of the Defense Logistics Agency, both under the Department of Defense, were not going to be attending the meeting. And that threw us for a loop. We did have the EPA there, Environmental Protection Agency, the Department of Health was there, the Board of Water Supply, ourselves, as well as our guest speakers. But that was very unfortunate. And there was a video that was put on Instagram not that long ago by a woman named Tara Rojas, who had interviewed Admiral Williams and asked him about the reasoning why they're not attending the Red Hill CRI. His response was that it's not as important to them as it is, to other people. And that was unfortunate, because the water that we drink and the remediation that needs to happen after the Red Hill spill is very important to us as residents, longtime residents, and as for our families as we raise our children on these lands and drinking the water. So this is what happened at the last meeting. And so now we're being promised that they're going to be at the next February meeting. And so we're hoping that they do attend that meeting. But in the meantime, because they did not show up at that last meeting, they were fined by the Environmental Protection Agency a very small amount, $5,000. I mean, for the Department of Defense, that's a small amount of money, considering that they have the largest budget in the United States. They were fined $5,000 for violating the consent order from Red Hill. And this was at least at least there was some consequence for them, for the Navy not attending the meetings, but they cannot continue to make excuses for why they are not attending. And the EPA and the Department of Health needs to hold them accountable as well to answer to the community. And so that's pretty much the gist of what happened in the last meeting. The EPA did announce that they were going to investigate that the fact that they didn't attend, they didn't show up. So thank you.
This is just an open opportunity for other CRI members to talk about how, what went well with the meeting, what could have gone better, what's changed. Does anybody else have any other opinions or perspectives they want to share about the December meeting? So some of the things that have changed from that we can expect to change going forward with meetings with the Navy, there's a requirement for a facilitator, something that we as CRI members advocate against because we didn't want to have any filtering of our questions and our conversation directly with the Navy, but we lost that. They will also the Navy will be allowed to veto any agenda items that we propose that they don't want to talk about. So that will be problematic, I think, because that'll be one way in which the Navy will, just have the potential to limit what we get to talk about with them. And those are the basic main ones. They did want us to try to sign at the beginning of the conversation about new ground rules. They wanted us to sign a non-disclosure agreement or something approximating that, basically that they would give us insider information, but we couldn't share it with anybody, which was an absolute no-go for us. So we were able to at least not have to comply with that. So going forward, we will have to work with the facilitator. I, in good faith, came to the meeting in December, went through the very uncomfortable, values conversation early on in the meeting, just to demonstrate that, we are here to be full participants, and for the Navy to, at the last minute, not show up and not have to go through all of that as well, just really solidified it for me that they are not in it to actually build a relationship with us and to try to rebuild trust. They are still playing games. I found it extremely frustrating and disappointing. Elaine, you have your hand up.
Yes, thanks so much for raising those issues with the conditions, because those conditions would have had a chilling effect on our ability to share information with the public. And it also would have also the end result is that the public has a greatly reduced opportunity to share the mana'o, because the Navy is only going to attend once every four months, I think, or every 3 months. And then yeah, once a quarter. And then during that time, instead of the whole hour that we currently provide for public input, they're only going to give 30 minutes, right? So they're able to veto the topics, and they're limiting the amount of time that people have. And also, I think there's a 2-minute time limit on the input. Yeah, so mahalo.
And also no longer the back and forth, right? Which was, I think, perhaps the most valuable thing about having the Navy meet with us in this setting, was because we could have a back and forth conversation. And, we did it as CRI members, and then, members of the community did it during the public testimony phase. But the Navy made clear that they will not be answering any questions in the moment. They have 30 days to give us any answers to our questions. So yeah, that's also disappointing. Helena, you have your hand up?
I did forget to mention that there was a letter sent to the Department of Defense and the EPA from it was a joint letter by a couple dozen organizations that were concerned with the new rules, and felt that, and communicated to the Department of Defense and the EPA, that these new rules and facilitator would actually silence the voices of the Red Hill CRI, that there was real concerns about that. And the Department of Defense and the EPA did respond with another letter citing the fact that we declined to go into mediation. Henceforth, that was one of the reasons why they decided to go this route. And the reason why, I just wanted to clarify that, why we refused to go into mediation with the Department of Defense and the EPA was because it wouldn't have been public. It would have been a very private, behind closed doors type of mediation. And that is exactly what we are opposed to. Thank you.
Melody, you have your hand up?
Yes, thank you. Yeah, my concern is that given that the Navy was a no-show, we were thinking about what would be an appropriate fine. And then we're hoping that there would be sufficient amount in which a atmospheric water generator could be purchased with that fine in order to provide clean water to the residents of Capilina Beach homes. And then come to find out that according to the AOC itself, any penalties or fines was limited to $5,000, which in this case is really just a slap in the wrist to the Navy. So I think it's more to give them, it doesn't disincentivize them. In fact, if they know that the only thing that'll happen is just a $5,000 fine, it might make it even more easier for them to decide, well, if that's it, we just will end up being a no-show. So it's disproportionate when it comes to building trust with the community, that it's an inconsequential penalty to the Navy that I would hope will be increased in time. Thank you.
Thank you, Melody. Okay, so I wanted to bring forward Wayne Tanaka, since he's the one that helped to organize the sign-on letter that Helani mentioned. And then I also saw that Michelle, you had your hand up. Do you want to ask a question before we go to other people? Go ahead. Or make a comment.
Oh, yeah, on that topic of fines, the whole reason why we ended up in this place was that instead of making necessary repairs over the many decades, the Navy has been paying the state fines, and the fines weren't enough to incentivize them to actually fix the leaks. So this is the same script. They're using the same behavior. They have proven over and over and over again that they do not have any intention to change.
Yeah, that's right. It's the same practices. We've seen no behavior change at the Navy's level. You're right.
That's a good point. That's a good point, Michelle. And I think it's especially concerning because the DOH just issued a $6,000 a day fine to a water provider, water supplier, right? So I think Tara has questions.
Okay. All right, I'm gonna hand it over to Wayne to talk about the community letter, and then Tara Rojas, if you wanted to ask a question, you can go after Wayne.
Hey, thank you, Chair and members of the CRI. Yeah, so the letter that we submitted, it was actually signed by 57 community organizations across a wide range of interest areas. Water affects everything and everyone here. So they raised the concerns that were articulated by Marty earlier regarding the unilateral power of the Navy and DLA to veto agenda items, refuse to answer questions if they determine any of those things are outside the scope of the ACO, with no recourse if they make an arbitrary decision. Like if they say, oh, PFAS are outside the scope of the ACO, even though the ACO talks about PFAS, there's no way to challenge that veto decision. Among other things, right? 30 minutes every 3 months for the public to talk. Public isn't even going to get a response from anyone because the ground rules prohibit responses. Unfortunately and disappointingly, the EPA letter. And Bill, this is not about this. Please don't take any of this personally. Like this letter, I'm sure came from well above your pay grade, but it was just very disappointing in that they refused to acknowledge any of those specific concerns. The EPA even went so far as to say they adopted the ground rules after or because the CRI declined to participate in mediation. And I think it's been made abundantly clear to the EPA that the CRI had very reasonable requests that mediation occur in public, and they could have easily accommodated that request, but instead, they just went ahead and adopted the very, one of the very things that the CRI said was a non-starter, which is that the Navy should not be able to unilaterally dictate agenda items. So I'll have to say I'm planning to put out a statement to that effect, just really expressing disappointment in the response, particular disappointment in the EPA and their kind of either perpetuating this disingenuous narrative. At best, at worst, it's almost like bad faith gaslighting of the community groups that signed onto those letters, as well as the CRI. And if there are no objections from the CRI, I will go ahead and push that out. But also open to any other thoughts that you may have in terms of what we say. Just you're here, as I've made it said before, we're here to support you and your work that you've been doing so diligently for the last almost 2 years now. So thank you.
Thanks, Wayne. Any questions for Wayne? Comments on the community sign-in letter? Okay, cool. Thanks, Wayne. Tara, you had a comment or question?
Aloha. So
Aloha.
before I begin, I don't know, Kalamai, Tita, I don't know, Helani, if you shared with them the November. So I went to their open house and, I confronted them, kind of gave them as best as I could, and Oro putting you guys on notice, and then he disappeared, and then they didn't show up. So with that, in addition to hearing them at this forum, as I mentioned at the December testimony, and in light of last week's and Wednesday and this week's Wednesday, I know it has to do with the Kai, the ocean, but still, just to realize at this point, it's crazy. We just got to keep standing against how supposedly big of an entity they are, and they limit our voices. So the Zoom yesterday was limited to question answer. There was no even raise hand, no even nothing, and they're filtering the questions and answers that we formulated into a question or comment into a question, and they're reading it saying these are comments. So if there's a comment, we suggest you send it in. You have until February 11th to turn in your comment on the Navy EIS about their bombing and mine practice and torpedoes and sonar in the Kai. So that I wanted to say, it did remind me of the Army when they were asking about renewal of their leases, and they added about that new option to get new land to continue to desecrate, like a land swap, where it was pandemic time, COVID time, and last minute they canceled the in-person meeting. Uncle Sparky them were there, and they did the Zoom meeting that I contacted beforehand, and they still made it where it was zero camera. We couldn't see each other, couldn't even unmute ourselves. And yeah, it was just crazy how they limit our voices. So with that, I just want to say, whether it's the kite, we got to put it into writing, because they did say in the question answers, oh, your comments, written comments are formal input that will and can change the course of, our decision when there's no action. And we just gotta find a way just to keep coming together to have them show up to here, have them find a solution and clean up our vibe. And again, I don't know if you remember it, but they're gonna be here beyond 2029 when leases are up, because land lease is separate from the cleanup, which is planned for 2031 plus, according to their poster board. So, just keep that in mind. Tita Jamie is on my live, and she's saying, Yes, Tara, they wouldn't even ask her question. Tita Jamie, they're not even asking her question in the question and answer yesterday about the kite. So, Kalamai, if it wasn't like a true question, but can I also ask if at the end I can offer maybe a solution, just a possible solution to having clean water, whether for the meetings or for your household, for those who are still having issues with your water, not being able to use water. So I can bring that up at the end. And just mahalo you all. Love you all. And I just found out a little bit before you started, so I gonna have to really glance really quick at the agenda. So mahalo nui.
Thank you, Tara. Yeah, it makes you wonder what it is, why it is that the most powerful military in the world is so afraid of hearing directly from residents of Hawaii. Fascinating. So I think we need to start to be strategic about how we're going to engage with the Navy. Those few chances that we're going to get, right? We'll have 4 meetings this year with the Navy, and we need to make sure that we use that time well, as best we can. And so people should be giving some thought to ways in which we can continue to hold the Navy accountable and have the community's voice heard even under these new ground rules. I, for one, am very interested in how the Navy spends their money. They've gotten a gigantic bucket of money for Red Hill, and it's been several years now. And I think it's time for us to get an accounting of how that's been spent, just to make sure we're not dealing with a lot of waste. Okay. Oh, yes, go ahead, Uncle Ernie.
Thank you, Marty. I'm still trying to figure out how to raise my hand. I'm just getting old and forgetful now.
No,
But,
no worries.
I
You
just
always
wanted
have
to-
the mic.
Yeah, no, thank you. I just wanted to let everybody know that BWS did send a letter on December 3rd to Secretary Del Toro, Lieutenant General Simmerly, and Michael Regan of the US EPA regarding the amendment to the ACO. So I can make that, send that to Madison, and she can share it with everybody. Thank you.
Thank you very much. We really appreciate all that you're doing. You're amazing. I do want to note a question or a comment in the chat from the audience. Asking about, were there any enforcement actions delivered to the Defense Logistics Agency or the Department of Defense pursuant to the 2015 Administrative Order on Consent, the enforcement action after the 2014 release of 27,000 gallons of fuel from Red Hill? And no. They got a lot of extensions for whenever they didn't turn something in on time, or if what they turned in was substandard. So they, but there were no like fines issued, or they got 1 or 2 strongly worded letters from the Department of Health and the EPA, but otherwise no actual consequences for not following through on several of the deliverables articulated under that enforcement action. So yeah, that's that. Elima, you have your hand up? Go ahead.
Yeah, just along those lines, that IG report that was recently produced and I guess reported on by Civil Beat talks about 38 different recommendations, but it also talks about a lot of missed opportunities, right? So there were opportunities to do this better. They could have learned from the prior spills, and they didn't. They covered it up, and they swore under oath that everything was all G, but it wasn't. So we need to hold them accountable.
Yes, exactly. Okay, all right. If there's nothing else on this agenda item from CRI members, are we ready to move on? All right. Okay, so the next agenda item is about a series of public health reports that have been required and required by Congress or other important agencies on the Red Hill issues dealing specifically with health, but they haven't gotten a lot of public attention. So I wanted to invite Kat up to help to disorient us a little bit on these reports that are linked in the agenda. Thank you.
Yes, hey, thank you. And I see that Tara has just logged in, so I'm actually going to see if she wants to unmute and if she wants to speak on these slides. Body wants to see if she's I know she's in the meeting, and if not, I'll go ahead and start and she can jump in when she's raised her hand. So if somebody wants to let her speak.
Hi, can you hear me?
Yes, we can.
Thank you, Tara.
Awesome. No
Yay.
problem. Today has been a little bit crazy, so thank you for being flexible. Yeah, these reports, not all of them were required by Congress, but they were all done for whatever the motivation was. So this slide here is going to just kind of highlight some of the major ones that are out. There's a lot of abbreviations down at the bottom of the slide. It'll explain what those abbreviations mean. But the CDC ATSDR has done 3 ACE studies. The first one was immediately after the fuel spill, like right away during the exposure window. And that one, they had a sample of 2,289 individuals, and it was like self-reported data. So surveys and interviews and people just explaining what it was that they were experiencing. The second ACE study was later that year, September 2022, and pooled the same participants from the first ACE study, but had 986 elect to participate. This was a survey, still self-reported data, but they filled out a form. The third ACE study was done the following year, and that one included 653 individuals, but it was only a review of medical records. So this time it was not a self-reported study. This one is looking at what kind of ICD codes existed in the medical records. Following that, last year, the University of Hawaii did a study on the social, economic, and health impacts of the fuel spill. That one we recruited from the same pool of that first ACE study, but 174 went into it. I say we, I was on that team. And this was, again, a survey with self-reported data. And then the most recent report that was released just this month was done by the Defense Centers for Public Health Epidemiology Data Center. Now, this one was, again, medical records. So they reviewed ICD codes in medical records. And this, they had the largest pool so far of people to look at. Within the Red Hill community, they had 44,373 participants. And the unique thing about this one is that they had a comparison group of unexposed individuals. These are also DEERS enrolled or military enrolled people that had, healthcare through the military system, and they are 59,499. So these are service members and families that are from like Schofield and MCBH. So go to the next slide. This here is a line graph from that most recent study, just showing the number of migraines. So that study looked at a set of specific diagnoses that were being reported, but they weren't being reported to the DHA by medical providers. It was actually community members that raised these concerns because, as we all know, we're all kind of a family and we talk to each other and we're like, oh my gosh, this is happening to me. Me too. I've heard this other person, and so these trends that we ourselves, this community has noticed were being discussed with DHA as, I think there's reason for concern here. And so they took that serious and they did a study of the medical records. Now, what we can see in this chart that's pretty noteworthy, every study has limitations of some kind. We're humans dealing with humans. It's never going to be perfect. And so every report that you read, you will see studies, limitations somewhere in the report, usually towards the back. And some of the limitations that weren't acknowledged for this study, I think, are really noteworthy. So, Kat, I'm going to let you say the EOE word because I don't know what that. I don't know how to pronounce that. But migraines and EOE were found in higher rates.
Eosinophilic esophagitis. It's a mouthful.
See,
Yeah.
Wait, and what is that? That's a headache-like
Yeah.
symptom?
No,
Cat
no.
Cat can speak to that.
Okay.
Yeah, so it's eosinophilic esophagitis is a diagnosis. This is the significant part of this, and this is one thing I wanted to comment about. It is a diagnosis based on symptoms plus a biological marker. They take a tissue biopsy. They take a sample through the esophagus. So you've got your food tube and your airway trachea, okay? This is a problem of where there's an immune system cell response that causes there to be inflammation, strictures, and people often report they're, quote, having swallowing problems, but the problem is not that they can't breathe, which is choking. The problem is that it's impaction, but frequently they go with reports of GI reflux-like symptoms is often an early indicator. So what is significant, and then I'll let Tara resume, is that early on, families frequently had to battle the narrative that said that all of this was stress related. So many of you are remember those days. And what is significant about this is that this was recognizing the limitations of it, this was a look through just what codes are given. If your doctor says you have a migraine, you receive a number, and that number is associated, meaning you have a migraine, you have a diagnosis of a migraine. And so it's a diagnosis for billing purposes, essentially, but also for studies like this. So if you get a diagnosis of EOE, eosinophilic esophagitis, it is based on not just the symptoms reported, but it is also that a biopsy was taken through an endoscopy. They go down through the esophagus and they take a scrape or a sample, and they see a higher level of these eosinophils. And so eventually, untreated, it can cause strictures where people can't have a normal swallowing, inflammation and swallowing wave is ceased or impacted severely, and then they began swallowing and the food just does not go down. So they often end up in the ER with what's called an impaction. So, and I'll let Tara resume from here.
Thank you, Ken.
Okay, thank you. Yes, and the ICD codes, that stands for International Classification of Diseases, and it's pretty much used to standardize the diagnoses, symptoms, procedures that, of healthcare. And it's not just the United States, it's actually maintained by the World Health Organization. So any countries that are a part of the World Health Organization uses ICD codes. And that way, even if like a lot of service members and their families have left Hawaii and they are overseas, they're still using ICD codes depending on, So anyway, just to kind of make that clear. All right, so what I want to point out in this chart that is particularly interesting, and I hope that you guys can all see it well enough, but at the mark where it says April 2022, you see the sharp decline taking place. I don't know if you can put the mouse on there, Rosalie, or whoever is doing the sharing, but you see that decline in the numbers, and honestly for both of the lines. And after that, things get wonky, right? So something that was taking place, and this is just specifically looking at the cases of migraines. So something that happened in April of 2022, that is when the Red Hill Clinic was opened in January of 2022. And in April is when they announced that they were going to allow for the entire water line to come in with secretarial designation. So you could be civilian, you could be military affiliated, but not in the DEERS system, all kinds of things. So everybody now had access to the Red Hill Clinic. The Red Hill Clinic was primary care providers seeing patients and giving direct referrals to specialists at Tripler. That was the goal of it. What happens in April when they opened up that door, then that was supposed to be really great and supposed to be helpful for everybody. But what also happened is Tripler went from 3 neurologists to 1. And so there was nobody for them to refer patients to. So even someone like myself who had an existing relationship with neurology, because I went to the Red Hill Clinic in January and was referred right away. So I had been working with a neurologist for 4 months. They dropped everybody who was not active duty. So nobody was able to see a neurologist at Tripler whether you were a Red Hill patient, a spouse, a dependent child, whether you had a diagnosis of epilepsy, whether you just had diagnosis of migraines, you could not go into Tripler after it was around April, end of April, May, somewhere in there. So as people then attempted to see a neurologist, someone like myself, I'm speaking about my own experience here. I was, because I kind of fought this thinking, but I'm a Red Hill patient and you're supposed to, you know, help connect us to these specialists. And I even went back to the Red Hill Clinic and they refused to see me because they couldn't refer me to anybody. So I went out into the community network, like basically I had to go find a different neurologist that would take me in. And the whole system ended up being so overwhelmed. I went onto a wait list that was 8 months long before, 8 or 9 months long before I could finally see a neurologist. So the last time I saw my doctor was actually on April 11th of 2022. And that from there all the way till December of 2022, I couldn't get in to see anybody about my migraines. So when you look at this kind of a chart and you see that wonkiness, it makes sense when you take into consideration how many ICD codes couldn't be recorded because you couldn't get in to see a provider. When I did finally get in to see the provider for neurology, my symptoms were not only migraines, I also have other things that this report looks at. Their findings did not show an elevated number of the other neurological issues that are occurring. But I just want to point out that when I saw the migraine neurologist, she said, oh, okay, the tingling, the muscle spasms, the cold extremities, that's a different type of neurology. We need to get you to see another neurologist in this office. And I went on to a 1-year wait list for that neurologist. I finally saw her for the first time this month. So it's kind of a lot to take into consideration when we see these bars going up and down. And clearly it was a system-wide issue because both cohorts were impacted.
Yeah, this is wild information. So just to make sure I understand what you're telling us, correct me if I'm wrong. So because there weren't sufficient neurologists available to see people after the Red Hill Clinic was made open to the public, anybody affected, the result is that the numbers of documented migraines and EOE illnesses actually went down. But that has to do more with the availability of people to make that determination, that assessment, as opposed to people actually having those, less number of people having those symptoms. Is that right?
So the experience that I'm sharing is neurology. EOE isn't diagnosed through neurology.
Okay.
So, but they also didn't include a line graph about those numbers.
Oh, okay.
The fact that they printed a line graph about the migraine, and I am sure that my medical, because I'm a DEERS enrollee, so I'm sure that my medical records are in there. I'm one of those migraines in that line graph. But I couldn't see a doctor between April 2022 until December 2022 about my migraines because I was on a wait list. And then that first meeting with that neurologist to start treating my migraines again was when I learned that I needed to see a different neurologist for the other neurological issues that I was having. And I couldn't get into that until this month. And I'm not the only one with that experience, but that is just something to really take into consideration. But this report did identify that there is a higher rate of migraines and EOE out of all the conditions that they were examining. At least those two, they were, despite what I'm describing, they still were able to see that there was a higher rate of migraines and EOE in the Red Hill cohort versus the unexposed cohort.
Thank you very much for that, Tara. I really appreciate it. And Kat, Elimi, you have a hand up?
Yes, I actually just had a real quick question regarding that Red Hill Clinic and the referrals. Now, at the time that the referrals were made, you said that there were 3 providers specialists. Is that correct,
Yeah,
Tara? Okay.
they had 3 that I knew of.
Was there any reason or any rationale given for why they, instead of increasing the number of specialists in this area, why they decrease the number of specialists if they have the same
Oh yeah, I mean,
number
it's
of
a military, yeah, totally. It's a military facility, so people, Hawaii is considered an overseas destination, or duty station, I guess would be the more appropriate term. And so when you come here, you're given your entrance date along with your exit date. You know exactly when you're leaving, because this isn't the same as like a continental assignment. So you know, it was just time for people to go to the next duty station, one separated from the military. You know, so it was normal everyday reasons why they lost neurologists, but you know, I had a plethora of my own questions at the time. Like, but you know, it had nothing to do with the Red Hill Clinic directly, because you know, odds are that you know, the DoD is so big, you know, you have this group talking to this group, but it's very unlikely that all the people, you know, admin versus this is 2 totally different conversations. So it was a really unfortunate setting that resulted in a lot of, I want to say inconvenience, but misery for the patients who were left without continuity of care. It was really unfortunate.
Yeah, that is
Thank
really
you for that
unfortunate.
clarification.
Sorry,
Yeah,
Lena, go ahead.
I know that they do have more people in now, but the historical information is really relevant when you're looking at these studies. And
It really was on them
Rosalie,
to articulate that particular change in circumstances for people to have a, you know, more comprehensive understanding of this data. Michelle, you have your hand
yeah,
up? Go ahead.
Yes, on that topic, it's curious, like if you're short neurologists and at Tripler, and they have all this money given to them for this issue, why could they not subcontract out other providers that are not affiliated with Tripler? Like, why wasn't that done?
Yeah, I wasn't able to get any answers. I mean, of course, when I had a hard time accepting that I couldn't be seen, you know, of course. And so that's why I went back to the Red Hill Clinic, and I was like, well, can you guys get me in somewhere else? Have you talked with any other local, you know, or like Queens or this or that, you know, just any other local providers to establish continuity of care, knowing that this was coming? And, you know, it's not like the Red Hill Clinic is who made people discharge from the military or made, you know, the end date come up for their tour here. Like, it just overlapped that way. You know, it's not something the Red Hill Clinic did, but they were definitely affected by it.
Yeah, but solutions like using the Department of the Navy's money in a way that helps to get people the care that they need but cannot get right now would have been one way to demonstrate their commitment to protecting public health. The fact that they didn't come up with that idea is further problematic and proves the value of these kinds of conversations. We can make the suggestion going forward.
Yeah. Now, I do want to just say before I jump off, Rosalie, if you share again the QR code on the slide with the graph, if anybody's interested in reading this report, it's only 17 pages, but the QR code is there. Okay, this one that you have on the screen right now, this is the publication that came from the first ACE study. So if anybody is interested in that, you can scan that. Oh, gosh, hopefully you have a second device at your disposal right this moment, since this is all virtual. But then the next slide.
We'll post this meeting link on our website, on the CRI website, and we'll also put the slides up as well. So hopefully there'll be opportunities beyond just this particular airing for people to look at this information. Sorry, go ahead.
No, it's okay. Rosalie, go ahead to the next slide. This is a 300-page report. This one was congressionally mandated, This is not a study per se where we have self-reported data, people talking about their experience, nor is it an ICD code. This is literature review. Basically, they took any kind of literature that was already talking about the health effects of the jet fuel used by the armed forces, and they just kind of put it all together to kind of get everything into one place and learn as much as possible with what exists. So this is a really good resource for people who like to nerd out and read, you know, that in-depth stuff. But this QR code will take you to that. And then the next one is, oh, that's the town hall. So this, can I jump into this, or are there questions about the health reports?
Yeah, wait, let's wait and see if there are questions for the health reports. What was the QR code that you wanted us to see at the outset? Maybe it's back. Yeah, this one. Here we
That
go.
one.
Thank you.
Yep. So that one is the one that people can read. This one's only 17 pages, but this one will talk about the health effects and the comparison between the cohort that was exposed, which was, let's see, the 44,000 something something, and then the yeah, there you go. The bottom line describes this one, the 44,000 and the versus the 59,000 of unexposed. So that one, that's a really good solid sample size for sure. The more people who provide data, the better your results are going to be, because you can see the statistical significance of things that way.
Well, thank you very much, Tara, for being a resource for us and for pulling together all this information and just making us aware and keeping us in the loop. I really appreciate it. While we have you, can we skip to the ends of these slides and talk about the town hall this weekend?
Yes. Yes. So as a result of all of these studies, the big thing that has really been a major takeaway, especially by a place like CDC, ATSDR, and our congressional delegation, is the fact that there are ongoing health effects, and there is a need to understand what these health effects are and what they might look like down the road, right? So because the knowledge of what exists about health effects on jet fuel is pretty limited, since you can't just design a study and intentionally expose people that way. So the Red Hill Health Registry is being formed, and we are having our very first town hall this weekend. It's on Sunday, which I know is terrible. We're asking you to give up your time on a Sunday. The hours are from 11 to 1:30 Hawaii time. So it's a strictly virtual. We were going to do it hybrid, in person and virtual, but we ended up with this overwhelming response of people wanting the virtual option only. So that's what we're going to go with. And you can register for it with the QR code there on the green one. I'm not sure. On my screen, it looks like it's on the left side, so I'm hoping that's right. And then one of the things that we're going to be doing is just giving a really good overview of the progress that we've made, where we're at. I held some focus groups in December to get information from people about what do you want from a registry? What are the hopes that this registry could provide for you? And so we're going to talk about some of the things that we learned from those focus groups and hopefully get more information. A really big thing that we're going to be doing is assembling a community advisory work group. And what we really want is we've said it from the beginning, that the registry to be co-designed with the community who needs it. So everyone here. So what we want to do is accept nominations of people who could be a part of that community advisory work group. This town hall is for everybody, whether you drank the fuel, didn't drink the fuel, want to be on the advisory work group, don't want to be on the advisory work group. This is for everyone. So, but if you have somebody in mind, whether it's yourself or someone you can nominate them using the blue QR code there on the right. The nomination form, I set it up so that I'm not collecting information about who you are as the person filling it out. So if you're nominating somebody else, I don't know who you are. I don't want to collect more data than I need. I just need to know who would be good on this committee. And it's one name at a time with a reason, and if you know their contact information. So Then after you submit that form, it gives you the option, do you want to submit it again? So if you know more than one person that you want to nominate, go for it. We will be making decisions after the town hall on the advisory committee. So you have until January 28th to provide nominations for us to look at. But I want to just give a real big shout out and plug about this registry, because one of the most important things for the community, like when we were looking through all of these other studies, the larger the sample of information and data that we can pull from, the more significant the findings are. So for us to fully understand the health impacts to our community, we need people. I mean, we hear from in these meetings a lot about the people with these really dramatic and life-altering occurrences. But I also know that there are people who didn't have major life-altering health effects as a result of their exposure. And that's just the reality. You know, our bodies all metabolize things differently, and we all react differently to things. But for us to fully, truly understand what jet fuel does to our bodies, we need to hear from every end of this spectrum of people who were exposed, whether you felt like you had no impact or a massive impact, and everything in between. Because without all of that, all we're going to do is hone in on an outlier population rather than the whole population. So I just really encourage everybody to go to redhillregistry.org and do the pre-enrollment, sign up when our formal launch happens this summer, attend the town hall, be as involved as you can.
Tara, just for you've said this in the past, but just for in case there are people who are new to this conversation, could you just talk a little bit about the registry's founding and like to what extent the registry is related or connected to the Navy?
Yeah, absolutely. Now, I will preface with I've had a heck of a day and I don't have my notes, so I might stutter and get some acronyms wrong. But on Sunday, when we do the town hall, I'll be much more prepared to answer that question. But the National Center for Disaster Medicine and Public Health is essentially who our funding is coming to us from. The military was held accountable fiscally, so the funding does come from the Department of Defense. But the way that it came to us is so far removed that we're able to operate completely independently from the military. We bring it up because I want full transparency. I don't want people to, to hear that, yes, the funding did originate here with the DoD and think that something was withheld. But it goes through the National Center for Disaster Medicine and Public Health, and that's in the Uniformed Services. It's USIS is the acronym. I just always forget the words, but I will have them on Sunday. But what happened is that the University of Hawaii was accepted into their Joint Disaster Medicine Public Health ecosystem. This is a fairly new program that's been around for a little over a year. The University of Hawaii was the first part of their footprint in Hawaii to have a quick mechanism to respond to the needs of disaster medicine and how, whether it's a man-made disaster or a natural disaster, but how it affects human health specifically. You know, we have all these other things in place to respond for infrastructure or the environment, but this is specifically human health. The footprint in the Pacific is growing because Queens Medical Center has also been added to that ecosystem. And I believe that there is another organization that will be added in the next month or two. I'm not sure, but so it's great. It's a good way to quickly mobilize the funding that we received. There was so much less red tape and bureaucratic delay in the way that happened. It was, a $27 million grant, not grant, but award that was given to us in an exponentially fast time from the time the conversation started to the end. I just started my job in May, so.
Right on. Thank you very much, Tara. You're doing great. Mai, you had something to add?
Hello there. As Tara was speaking, I was just reminded about the significant failures of the Red Hill Clinic and why the study probably missed a whole bunch of folks that just gave up, like me. We gave up early on about the Red Hill Clinic because at first it was only open 2 days a week for some weird time, like 1 to 3, really awkward time during pickup for kids. They never answered their phones. So some people I know were on hold for just half an hour to an hour to no avail. Now it's gotten better, but only in the last 6 months or so. So for the first 2 years, please keep in mind, a bunch of people were trying to access Red Hill Clinic and access doctors, but they could not access those doctors because they were telling us, your symptoms are not related to the water spill and there's nothing to see here. These are not the droids you're seeking. And the neurologist bit kind of gets me going because my son also has migraines, but we're still being told, no, the migraines and the sleep issues have nothing to do with the fuel. So it's people like us are still being refused treatment and that ICD code to be entered into our medical records. So I still am having trouble putting in fuel, polluted water, bathing water pollution, whatever that ICD code that is supposed to be in our medical records, it has not been entered yet. And I am one to keep trying. So you can only imagine how many other people who were just told no at first and then just gave up.
Yeah. Now the that study had, there was not 44,000 people who went to the Red Hill Clinic. So the ICD codes were not strictly those that came from the Red Hill Clinic. The only reason I brought up the Red Hill Clinic was because saying that Tripler lost their, staffing in the neurology department, it doesn't sound like it would make sense for the Red Hill community unless you know that that's where the referrals were being sent to. If you did go, if you were part of the Red Hill community and you went to the doctor. Now, active duty service members, civilians who had maybe TRICARE Select, where you can get your referral outside of Tripler automatically. These people may have already had their relationships established outside of Tripler to begin with, because 44,000 is a much larger number than what Red Hill Clinic ever saw. I think they're in the single 100s. For comparison. But yeah, the hours, they started out being open 5 hours a week or 5 days a week, and I think now they're open 4 hours a week. I think I could be wrong, but I think it's Tuesday afternoon from 12 to 4. You need to double check. If you were to Google Red Hill Clinic hours, you would be able to find their page and confirm. But they still do not have virtual appointments either. So if you are to be seen there, you have to make an appointment. If you don't have base access, you can still be seen there. You just have to get the secretarial designation. And if that's a question that somebody wants answered, I can get that information and respond. I don't have it right now. So, in my car.
We saw your email address on the slides for the town hall. We can just put that in the chat. So if anybody who is following this meeting and they want to follow up directly about the Red Hill Registry, you can contact Tara directly. She works there. Okay.
Yeah, I don't work at the Red Hill Clinic. I work at the Red Hill Registry.
Right, registry, right. Sorry, did I say clinic? My bad. Thank you for correcting me. Yeah, the Red Hill Registry.
No.
Thank you.
All right, I am gonna sign off if there are no other questions for me.
Okay, wait, hang on a second. Let's just double check. Any other questions for Tara before she leaves? She has to attend her family. And did note in the chat that Elima made a good suggestion about maybe we could ask the Navy for an audit of the clinic services. That's something we should definitely consider. Good suggestion. All right, yeah, seeing thumbs up. That's great. Okay, Tara, you're free to go. We know how to bug you. Thank you very much for all that you do and hope all is well at home. Okay, we are now ready to move on to agenda item 4 with everybody's, sorry, go ahead.
Before you go on to the next agenda item, I did see that there were a couple of questions for Kat about EOE. So
Oh, thank you.
make sure to follow back with that. And I'm going to sign out. Bye, everybody.
Okay, bye. Okay, sorry, it's hard for me to manage the chat and the actual meeting. So, let's see. If people have questions about EOE specifically for CAT, now is a good time. Otherwise, we can take care of it later too. Okay, how about Kat, if you're okay to stay on for the remainder of the meeting, we can maybe revisit people's questions and concerns during the public testimony phase. Okay, thanks. Okay, we're ready to move on to agenda item 4. This is debriefing the technical meeting between the Board of Water Supply and the Navy's swarm team. I have always thought that stood for something. It doesn't stand for anything, it's just another made-up word. So Ernie Lau, who is the head of the Honolulu Board of Water Supply, is here to help walk us through that December 10th meeting. In the agenda is a link to the recording for that meeting, which you can watch later. It is very long and very technical. So I'm hoping that Uncle Ernie can make it a little more accessible to us. Thank you.
Well, I keep it very simple. This meeting occurred on December 10th. It was originally supposed to run from about 9 to 11:30, but it ended up going another hour. I could only stay to 11:30 because I had to be at the December 10th press conference on the new proposed landfill by noon. But basically, it was it was something that the Navy called for. I had after the FTAC meeting earlier in the year, Admiral Mark Williams approached me about getting our technical people together to talk about our comments on the swarm team memo, and with the and I thought with the idea that we can talk about how to make it better, how to improve it. But what it turned out to be was more of a very scripted type of meeting where the majority of time, I think maybe until the last 45 minutes, was the Navy actually doing a presentation, PowerPoint presentations, referring to information that we'd never seen before because our experts and the BWS team here, we only looked at the swarm team memo that came out months earlier, and we didn't have access to all the new information they were actually presenting at this December 10th meeting. So it was very one-sided. It did start out with Mark Williams, Admiral Williams, basically saying some pretty harsh comments about the Board of Water Supply, about myself and the board chair. And we didn't even have a chance because they controlled the meeting through their facilitator to actually give a rebuttal. So most of the meeting was Navy presenting information that we'd never seen before, opining that we were wrong, and then giving us a short period of time for a question and answer later. I did ask that the information they presented be available to us. And I do want to report, the link in this, in your agenda is actually to the Board of Water Supply website, boardofwatersupply.com. What we did was we did our own recording. There's also a full transcript. Wayne from my staff worked very hard to actually provide a transcript of all the dialogue that went on. If you have nothing better to do, you can go take a look at that. So where are we at today? So we're looking now at this additional information, which is actually available at the Joint Safe Waters website. So go to Joint Base Pearl Harbor Hickam Safe Waters website and look at the not the environmental information on the Safe Waters website, but the water system information. Then you'll see actually a recording. You'll see the supplemental materials that they were referring to, and it actually turns out to be a 164-page report that we'd never seen before. So where we're at right now is I've asked our technical experts, many of you have actually met them before, to actually take a look at that report, and we're we plan on providing a response to a letter that subsequent after the December 10th meeting, they sent us a letter basically, I think indicating that they were right all along. So we're going to be responding to that. They even quoted one of our experts, but I think it wasn't taken in its complete context. One thing that I came away with is that they are now saying that all the 8,000, and it turns out it's actually 9,000 tests that were done during the swarm team period of 2 years. They're all valid. And I still, I'm unable, and I want to be very polite here, unable to wrap my mind around that, because I thought they were saying that, and the swarm team tech memo came to the conclusion that, at least for the TPH analysis, because they didn't address the fact that public water system water is chlorinated, and that's a well-known fact, that they didn't actually try to deal with the chlorine first so that it wouldn't distort their results. But now they're saying it's all valid. The other thing I heard too was that they're really trying to focus the conversation is on JP5, that they didn't find evidence of JP5 fuel in the water system. But we know, at least I feel that the result of the contamination of Red Hill Shaft wasn't limited to only JP5, because we know from their total petroleum hydrocarbons as oil fraction that they were detecting significant levels there. So some of the older fuels that was still residing between the bottoms of the tanks and the top of the aquifer, somehow got mobilized and also got into the groundwater, into the shaft, and was pumped into their water system. So, and then also once the fuel goes into the water system, it dissolves. It also may change over time. So maybe you're not going to find the exact signature of JP5, but that seems to be their messaging right now. And I don't know if you folks have also seen that. I have Joyce Lynn, who was with me, my young engineer in Red Hill. Joyce, you want to add any comments on the December 10th meeting, which you were there to watch it unfold? Go ahead, Joyce. Okay, maybe she stepped away, but
Sorry.
yeah, that's basically it. Oh, I'm sorry, Joyce, go ahead.
Sorry, I stepped away. Can you repeat the question or?
If you wanted to share any of your observations, thoughts about the December 10th Swarm Tech Memo meeting conducted by the Navy.
Well, I felt you had a good description, overview of the meeting itself. It was very script in my perspective, sitting behind you and Chair and our Deputy Erwin. They had a full agenda on what they wanted to discuss, and they facilitated the meeting, so we couldn't really provide responses to comments that they bring up throughout the whole discussion. We had to wait until the very end of the meeting to sort of catch up and provide feedbacks. So, yeah.
Yeah, so in a way, I saw that one of the attendees on this meeting was actually the facilitator for the Fill Tank Advisory Committee meetings. I think and unfortunately, I don't think we have full control over that. It sounds like even the EPA with the agreement and how to amend the process or the engagement with the Community Representation Initiative members, stakeholders, it's really highly controlled and scripted. And real conversations like what I heard earlier are very difficult to happen under those circumstances. And it's very unfortunate. I'm very sad. I know that there is the temperature in terms of the aggressiveness of the Navy in attacking the Board of Water Supply has increased, and we will continue to stand our ground and try to work with them as collaboratively as possible. But unfortunately, by arranging meetings like this, it doesn't allow for meaningful discussion, two-way discussion. So I just back to you, Marty. Thank you for the opportunity to speak tonight. Aloha,
Hey.
everybody.
Thank you, Uncle Ernie. Just hearing you share a lot of my same concerns makes me feel better for some reason. Thank you for keeping on. Okay, I'll open up to questions to members of the CRI. Do you guys have follow-up questions? I have a bunch. Go ahead. Okay, I'll start. Okay, so okay, I have so many questions. I'm trying to figure out where to start. I guess first, so the Navy is saying the 9,000 samples that they took with the quenching. So are they saying that they don't have to quench anymore? Like, turns out they didn't have to do that, or are they conceding that they should have quenched for chlorine before doing anything and that they messed up? I don't understand how they can say now that the false positives are fine.
Yeah, they're basically saying, and I think my impression is that the 9,000 samples and the test results are valid. But I think in the Swarm Tech memo, they were trying to explain why they were actually not valid, and that the detections were because of the influence of chlorine in the water samples. So that's what I couldn't get my head around that, and so our technical experts are going to look at the additional information they provided, and we'll be responding in writing to the Navy. Yeah, which is kind of interesting because both the board chair and I recall having a face-to-face meeting with the chief of naval operations. The chief of naval CNO, Admiral Gray, and I think he told us basically they were not valid. When the board chair asked the direct question of him, was the 8,000 test results valid? And he said no. So
they're changing their story. They get to do that because they hold all the money.
And also they had a whole bunch of information that when we did our analysis, we did it strictly on the Swarm Tech memo from the original Swarm Tech memo. And we weren't given any additional information or access to that information.
All right, thanks. Could you talk a little bit about, so there was a long-term water monitoring plan, and then there was the extended drinking water monitoring plan. Do you know, have they talked at all about what they're going to do after this extended drinking water monitoring plan is complete, right? I think it's the spring of this year.
No, they didn't talk about that. I think they did mention, and it's on the Joint Base Safe Waters website, that plan has actually been approved by the regulators. And in that plan, we plan on suggestions to even improve it. But it's better than the original long-term LTM, long-term monitoring plan. That covered the first 2 years. But beyond that, what are they going to continue to test? I am not sure.
Yeah, we need that. Yeah, I think, the fact that the extended drinking water monitoring plan is an improvement on the previous monitoring plan just goes to show that, like, so long as we stay engaged, we can actually make things, at least a little bit better. So in terms of just like overall, like taking a step back, there was that plume of contamination that we got a quick snapshot of in the IAO well. In general, do you feel like we've gotten any more clarity on what are the issues with our water contamination?
I still feel that there's a possibility that the contamination plume, and I think there is going to be contamination plumes in the underground aquifer, that it's moving, and we don't know exactly what's in it, what wells will be impacted, but we know that now we're detecting PFAS in our Halava shaft on a regular basis. And that and Halava shaft is not pumping water into our system, and we're just able to take samples from the shaft without turning on the pumps. But I think it's still there. There needs to be a lot more monitor wells installed. So we are continue to push toward that effort. I think the Navy will it's important to watch if they continue the same level of aggressiveness in installing more monitor wells. And preferably those monitor wells shouldn't go on military property. It should go on other property, government, city or state or private property, but in that whole Halava Valley area to give us a better idea of what's underground in the aquifer. So that effort hopefully will continue. We are have put in a request to get more money from and I appreciate the support of our state legislature to install monitor wells. So you know, we were just grateful that a couple of the legislators were willing to put in a bill for us to ask for additional funding from the state general obligation bond, geo bond funding for more monitor wells. And I think one of the senators, Senator Gabbard, put in a bill. I don't know if it's going to be heard, but asking the Department of Land and Natural Resources to put in 100 monitor wells around Red Hill. I think that those are good steps in the right direction. The Navy has come out and reissued a new groundwater flow model report with less redactions. So folks, you might want to take a look at that report. I think it's on their Safe Waters website too. Joyce, do you know if it's on the Safe Waters website?
It is actually, I believe, on EPA's website, but I can find a link and share it in the chat.
Okay, thanks, Joyce.
Mhm.
Yeah, Lonnie.
Oh, hi, Ernie. So I have two questions. So is there any plans to open Halava well or to shut down additional wells at this point in time? And then the other question was about the legislation, but I will definitely look it up. Is it Senate Bill 656?
You know, you got me, hey, Lonnie. I don't know the number.
Okay, I'll put it in the chat.
Okay.
The bill. But yeah, if you could kind of give us an update on
Is
the
that
wells.
is that the
And the Red
100
Hill
wells?
well, do you think that's a good idea to reopen?
For the Board of Water Supply, our Halava shaft, our Halava wells and IA wells will remain shut off. We are, and I just want to thank you for asking that question. I want to also update you that we are looking at installing a temporary water treatment system at our Ka'amila wells, which is a little bit more to the west from our IA wells. And that's a temporary activated carbon or GAC system and that we are going to be installing at that site. And we'll keep you folks updated on the progress on that. It's currently, we're formulating the project and we'll be putting it out to bid soon.
Thank you. I put the bill in the chat. Thank you.
The other thing too is that this SB 656, I think, is the 100 well request from Senator Gabbard to the Department of Land and Natural Resources. I thought it was 100 wells. Maybe he took the number.
Yes, I think it says 100
It
wells.
says 100 wells.
Oh, okay. 100 monitoring wells. Yeah, I didn't dream that. But the other thing to be aware of, you're probably aware that the Navy is installing a temporary GAC water treatment system to treat the water at their Aya Halava shaft. I think you're already aware of that. 12 contactors are in place. And I don't know if it's operational. Haven't heard if it's operational yet. They'll need Department of Health approval to do that. So they plan to place their Aya Halava shaft, which was shut down shortly after the Red Hill shaft contamination incident. They want to turn that back on and supply water to their water system.
Thank you for that, reminding us of that. I appreciate it. Any other questions? Right. Going once, going twice, and we can always come back to it. Thank you very much, Uncle Ernie. We definitely appreciate you. And thank you, Joyce, for
Hello.
being on the spot. Okay, so we can move to agenda item 5. This is just to make everyone aware of the EPA's responses to the CRI's questions. There's a link to the email, and Elima, you want to introduce this issue?
Yeah, sure. So basically, we've been asking questions of the EPA since the inception of the CRI. And just as an informational, we're up to, I think, 405 questions. So this is in response to questions 397 through 405. I think the most telling of this is that the EPA continues to insist that the water is safe. Basically referencing JP5 again, and pretty much ignoring any other types of fuel or PFAS that may be found. But they did acknowledge lead in the water. So that's something that they did acknowledge, and I hope that people will have an opportunity to take a look at this information. I don't know if we can put this up in the chat for everyone else or if it's on our website, but I think it's important for folks to know that to a certain extent, in the same way that the EPA was willing to go along with the amended ACO and a lot of the limitations and restrictions, to transparency and public insight into what's going on with our water supply. Here again, the EPA, based on their answers, seems to be indicating that the Navy is correct, that the Navy has not done anything wrong, or at least the water is good to go and the water is quote unquote safe, or at least it meets the safe drinking water standards. So I think that this seems to kind of validate some of what Ernie was saying about the Navy being very focused on JP5. Here again, it's a focus on JP5 and not a focus on other types of fuels that may still be lingering in the system. And then another issue that came up talked about we asked the question, one of the questions was, what about the regulating the fuel that's being transported? And we did get an answer. The answer was that the fuel itself is not regulated by the EPA or that fuel line. It's actually regulated by the Department of Transportation. So I did send a question to the Department of Transportation, asking them to let us know, what the process is for filing some sort of inquiry or complaint about the transportation of the fuel along those lines. And we haven't received a response yet. The other question that I think was asked that probably people do want to know about has to do with disclosure in leases, and the Department of Health as well as the EPA are both saying that they don't have any control over those leases and that it's not the responsibility of the Department of Health or the EPA to make sure that landowners or land lease owners or management companies have to tell their residents. They said that the only time that they would have to provide some additional information is if, for example, they didn't meet the safe drinking water standards. And according to the EPA, the Navy and everything else seems to fit that bill in terms of meeting the safe water drinking standards. So, we're still at a point where we're trying to get the EPA to do more. They are answering the questions, but again, very scripted and very pointed and not, being broad enough, I think, for the liking of so many of us. So I hope that everyone will get a chance to take a look at it. And I don't know if anybody has any questions or concerns along those lines.
Thank you very much, Lima, for that report back.
Thanks.
I appreciate it. Any other from the CRI members? Are there any other comments about or questions, clarifications, anything around the answers to our questions linked in the agenda?
I just want to say that they used to attempt to answer them or at least respond to our weekly request for answers. But at this point in time, it's been months, they don't even acknowledge that the questions are there at this point. So it's really they've clammed up, and I think it should be a concern for the community in going forward, because, you know, and as the CRI, we're not gonna be beholden to all these new rules. And we're gonna have a EPA, we're gonna have an external facilitator too as well. So our hands are gonna be more tied.
Yeah. I mean, my assessment is they basically just got overwhelmed. We had more questions and they knew how to answer. And under the new ground rules, they are requesting that they get a clean slate. Start with question 1 again. 'Cause they don't want to have to be held accountable for the 400 outstanding questions that are in the back. So I'm grateful that they are at least following through and trying to answer the questions that remain outstanding from, you know, the previous year. And you know, under the new ground rules, they wrote, they are committing to responses within 30 days. So I think that's another thing that we need to just sort of ride herd on and make sure that they can, you know, they follow through on that. And if they don't, that there's consequences somehow. We just, you know, we'll figure out what to do next. All right, Susan Garmer-Chang, you have a question, comment?
Yes. Okay. Yeah, so I was on the CRI. I was one of the people that stepped off so we could get some new people in. But the last, as far as I know, the last time they answered questions in writing was March 21st, 2024. And then in May, they actually cut off all contact. We were emailing the questions to Nui. He was our you know, facilitator, whatever. But then in May, he said there would be no further conversation or emails at all. So yeah, I think there's maybe about 200, there could be more, just for the Navy that they still haven't answered. And they didn't even bring that up in the December meeting. I mean, these are, you know, these are questions from CRI members who, you know, read through reports and, you know, spent a lot of time really digging into all this information that's always coming out and coming up with really good questions. And I feel like the Navy just wants to pretend it never happened, that they don't exist. So that's my frustration. Thank you.
Yeah, thank you, Susan. I think we
Thank
all
you,
share
Susan.
that frustration. It's outrageous.
Yeah, and I
Sorry, go
wanted
ahead.
to acknowledge that Susan is actually was actually the individual that did the most work when it came to soliciting the EPA and the Navy to get those questions asked and answered. Susan went out of her way to get all of these questions. It's not just from CRI. Many of the questions are generated from meetings like these, right? So since the inception of the CRI, regardless of her status, but whether, you know, as an elected member or not, Susan has done an incredible job, and I just commend her. Thank you so much, Susan, for everything you've done.
Yep, thank you. Thank you very much. Okay, any other comments or questions about the 400 questions? Okay, keep on keeping on. We're getting answers. We're going, it's forward movement, slow as it is. Okay, we are moving on to agenda item 6, which I think we went through already. This was the Red Hill Health, the registry that Tara was talking about. So if you guys, unless there's anything else to talk about that, I think we can move on to agenda item 7, which is the bill legislation update. Melody?
Okay, thank you very much. Let me make sure. Let me see about my camera. Hang on.
There you go.
Okay. Oh, there,
Thank you.
not too bad. I
Not
was
too bad.
having a lot of backlight, but now that it's getting darker outside, it's don't look like a ghost. Sorry about that. Okay. So thank you for the opportunity to talk about the bills. I'd like to start with SB 539. And this bill would allow for state agencies that will monitor environmental toxins and pollutants to establish EALs, environmental action levels, to ensure the preservation of a safe environment. This bill came about because, as you know, for the last year and a half that we've been working on it, we've been struggling with the EALs. Initially, it was at 266 for TPHs, and I guess recently it's been now lowered, thank goodness, to 100 TPH EAL. So what this bill calls for is whenever there is any movement with the EALs, then the Department of Health will have to provide public notice as well as a hearing, and that individuals can actually petition the DOH to have the EALs more, what is it? So that there's more preservation of the environment as well as reducing the risk of human health. So as we have seen with many of our members and participants in the CRI, where they have suffered, and that the amount of TPH that was found in their tests showed upwards, actually downwards, like 25 to 50 amounts of TPH in the water, and that was sufficient in order to cause symptoms of contaminants in their water. So that's Senate Bill 539. And further, it would have to be based on scientific justification, and this scientific justification would be based on the severity of the risks to human health and to the environment. Now, this bill, it was introduced by Senator Gabbard. It was actually introduced twice. So we have a second number, and that's SB 667. Okay, and then the next bill. Now, this is the one that Ernie Lau was talking about, and that's SB 656. And so in this bill, it is asking that the Department of Land and Natural Resources install 100 monitoring wells to collect data and map the migration of the Red Hill contamination plume. So the reason why we wanted to have 100 monitoring wells, I'll say because Ernie suggested it to me, and that's because we're afraid that the plume is venturing into the Oahu's municipal water system. And so without these monitoring wells, and especially since we've seen that there's been migration towards the IA well, and there's that risk, as Ernie has indicated, that it may be venturing into the Ka'amilo well. So therefore, having these monitoring wells, I mean, hopefully the Navy will do it, but we don't know if that's going to happen. So we want the DLNR to go ahead, and hopefully we'll be able to get these monitoring wells. Okay, and the next one is Senate Bill 664. Now, this one came about through the introduction basically from Ilima, and we were concerned because the Department of Health has indicated that their jurisdiction and authority and power only goes up to, I guess it is the streets and not into the house, not into the homes or the businesses. And we have instances where testing of the water should be done beyond just the streets, but it should actually be testing also in the homes and in the businesses and the schools and what have you. So this bill would expand the Department of Health's authority so that they can go ahead and do water testing in private premises. And the reason for this, again, is that the residents, and I believe those were the ones at Kapalina Beach Homes, and they are subject to the Navy's water lines, which has been contaminated with petroleum as well as PFAS, and yet they're not having the proper testing done. So that's what this bill calls for, and it also calls for an appropriation for these tests. Okay, now Senate Bill 536. Now this one, we've been trying to get this one passed for several sessions, and that is asking for an environmental toxins testing lab. And this one is for the Department of Health so that they can expand, build a EPA certified lab so that we will finally have a lab on island for immediate response, because that seems to be the problem, is that we're not getting immediate responses. We're getting responses, within a month's time and sometimes even more, which causes a month of more contamination and symptoms to human health as well as the environment. So this one, let's see. So it is so that there could be testing for the presence of toxins in the air, water, soil, as well as biological specimens. And it would be for public access. So it's not just government agencies, but also public access. If they want to have their specimens tested, then their soil, their water, what have you, then they should be able to go to the Department of Health at this lab and get an EPA certified test result. All right, so the Department of Health, they are to obtain and expend federal funds, but if they cannot get that within 9 months, then state funds should be used for this purpose. All right, so next is Senate Bill 1193 and also its companion House Bill 305. And this is Healani's bill. So in this bill, it is the creation of the Aloha Aina Land Trust. And this would be a new state entity, and it'd be designed to manage and rehabilitate lands previously leased to the military. And this is after those leases expire. So those would be the 4 military leases. I believe, I'm not sure about it's Pohakuloa also. Okay, Pohakuloa probably should be included. So that means it's Po'omoho, Kahuku, and Makua. All right, so in this one, the Aloha Aina Land Trust, they'll have trustees, and the trustees, there'll be 7 of them, and to be appointed by the governor. And they would include representatives from the Board of Land and Natural Resources, from OHA, and professionals that have the expertise in ecological rehabilitation, regenerative agriculture, and cultural programming. So the land transfer, it's going to be first offered, which is good. It's going to be first offered to the owners of the inheritable Kuleana lands. So that's interesting. That would be the Hawaiian land holdings. And so they will have the first right of refusal. And if there is no owners that exist, then the land will be transferred to the Aloha Aina Land Trust. What will this trust do? The trust will include ecological restoration, promoting regenerative agriculture, supporting local food production, establishing educational and cultural programs, and prioritizing community-led stewardship with an emphasis in indigenous knowledge and traditional practices. One thing that's important about this trust, or at least the use of the land, none of it will be used for it'd be only limited to be used for non-commercial purposes. So that includes environmental sustainability, cultural preservation, and community development. Funding. Okay, so if these lands were previously classified as government or crown lands before 1895, then the land will be held in a public trust with potential future transfer to a recognized sovereign Native Hawaiian entity. And implementation, the bill calls for the trust to begin work as early as July 1st, 2025. Okay, did I pretty much sum that up good, Heleni, for you?
Yes, thank you so much.
Okay, moving on, we only have, 2 more bills, but it's a companion. And that's SB 150 and HB 505, and that establishes the VI Policy Coordinator for coordination of Red Hill VI initiatives. So this one would create a special fund, Red Hill Remediation Special Fund, and establish the VI Policy Coordinator for coordinating of the Red Hill VI initiatives. All right, so what is the responsibilities? Okay, this bill emphasizes the state's unique public trust responsibilities as set forth in the Hawaii State Constitution, which establishes an affirmative duty to preserve and protect public trust resources, including water resources. So what is the Red Hill Vi Alliance initiative? What is their initiatives? First one is aquifer remediation, cleaning up the contaminated aquifer to ensure safe drinking water for Oahu's residents. Second one is the integrated approach, and that would be a comprehensive and integrated approach to resolving the water crisis involving the state, city, and regulatory agencies. Third one would be monitoring and testing. We went over that. And this one, now under the VI, they want 122 monitoring wells, by the way. Okay, so this one would be establishing a network of monitoring wells to track the contamination plume and ensure ongoing water quality testing. Fourth one, public education and transparency. The initiative emphasizes the importance of public education, transparency, and accountability throughout the remediation process. And finally, the fifth initiative, collaboration with experts. This group will be working with subject matter experts to formulate recommended policies and actions. So that's it. Basically, for the VI, it's so that we would have a special remediation fund as well as a VI policy coordinator to coordinate these Red Hill VI initiatives. So this bill was from Chair Linda Ichiyama and her group. All right, I don't know if there are any other bills out there that any of you would like to share, but that's pretty much the list that I have on Red Hill.
Thank you very much, Melody. Okay, Ernie has his hand up, so does Helani and Tara. So let's see, Helani, you want to go first? And if there are any other CRI members have questions, and then we can go to Uncle Ernie and then to Tara. You're muted, Helani. Sorry.
Okay, I wanted to make a comment about Senate Bill 150 and HB 505. It has a lot of referrals. So HB 505 has 3 referrals. It's almost like dead in the water, but it's unfortunate that these bills have all these referrals. Even a lot of the other bills, even the military leases, on the House side has 3 referrals. And all of the House bills that are important for our water and land have to go through the Committee of Water and Land in the House, which is chaired by Representative Hashem. So we need to focus on Hashem to get some of these bills out, because these are bills that our community needs. Is for the health and safety of our community. Thank you.
Thank you, Helani. Any other questions or comments from CRI members about bills? Going once, going twice? Okay, you had something to, oh, sorry, go ahead.
Yeah, we have 2 hands up.
Yeah, I was trying to go for CRI members first.
Oh, gotcha, thank you.
Yeah. And then, okay, so we'll go to Ernie next, and then Tara, and then Jamie. And then we'll just slip into public testimony, because we'll be right on time.
Okay,
Rare.
thank you, Melody, for the comprehensive update on the bills and quite a bit of effort there.
Yeah, welcome.
And I can reach out to you. I've already kind of spoken to Chair Hashem a few times, and I can try to really push him to actually hear these bills. I guess he'd be the subject matter committee for the first hearing, so I'll work on that. One thing to keep in mind under the current situation with the new president in place, not as sympathetic to maybe the environment and to our concerns, especially about Red Hill and other things. I think that we can use this time to try to build infrastructure at the state level, in state law, in state government, like the VI bill, the special fund that we can establish now to actually be ready when maybe the next administration or might be more willing to actually provide funding, federal funding, then we'll have a place to receive that federal funding and help to coordinate its use with community input. So I guess I don't want to say we should despair the situation, but we should have hope and still continue to try. Thank you.
Thank you, Ernie. Yeah, just want to double down on that. I think it benefits us regardless of what the future holds. It benefits the people of Hawaii for us to have more infrastructure, right? The lab for testing, the monitoring wells, all of that is helpful, regardless of who's in control. So those are the things that we should double down on. Okay, Tara Rojas, if you're available. And if not, we can come back to you, no rush.
Aloha. Sorry, there's a
Aloha.
issue with the mute.
Yeah, no worries, go ahead.
Well, I had a question about the Aloha Aina Land Trust. And I see, that Molokai, that's what they did, in order to preserve the Wailau Valley. Maui, I know. And then, so now this is for Oahu. I had a quick question on process. Why is it that has to be like governor appointed? Just don't trust the governor. You know what I mean? With water commission, with the lawyer position, with just everything. So that's just, I guess, my concern. Like who are these people? Is it going to just be like another entity? I understand, where it's coming from and the purpose, but yet because of history, it makes you wonder, is it going to be another entity upon another entity with the same players and then the BLNR back in there? So that's another thing too. With I know this is the Navy, I know this is CRI Red Hill, but it's connected together where how can that BLNR chair be in all these different meetings? How can she have like I guess authority or a very big percentage of authority to even head or be a part of so many very important major agencies. Yeah, okay, so that's my first one. And then just giving the kudos to, Ernie Lau and Water Supply. I hope there's a way that with all of us here, even if we'll keep seeing each other everywhere, that we speak up for the vibe for everything. I did go to the Aole landfill rally. I did watch online, as many of us, the Zoom, the hearing, and we just got to get it into their minds because the Navy and the military and Department of Defense are all connected to our water, whether it's going to be the landfill, the Red Hill, and with many others. So what was I trying to say? Just the fact that it's our vai and they are infiltrating into everything. Like the Navy is in the water, the Navy is in HCDA doing the electrical. They are now infiltrating the university. They are like everything. It's almost like we want to make it stop now and not a repeat of history. So what can we do to protect our vai completely?
Yeah, Tara, I'll just say that I think your concerns about who gets to appoint who is important. It matters. The way the water code is written, the governor gets to appoint 2 people to a nominating committee. And then the Senate president and the House Speaker each get to appoint 1, and then that body comes together and identifies candidates who are qualified to sit on the Water Commission. And the idea behind doing that was to try to insulate the Water Commission appointee process from political influence or, the undue influence from people who are wealthy and benefit from certain water policies. So that's just to say that we don't have to have it be that the governor picks the people. We could come up with another mechanism for doing that. The governor can have 1 pick out of a couple people. Your point is well made. Okay, Jamie.
Hey, aloha. I was just wondering if there's a way to get a list and to streamline the bills that are important. And as Halani was saying, with the three referrals that are already there, I hope I'm saying that right, that are knocking one of the bills out for those that have not got online and submitted testimony or ever advocated for this before that want to get involved. That way we know exactly, if we could put together like a list, so we know exactly what bills are most prudent, and then the way for them to navigate the system. Because anybody that's never gone to the site before gets lost, and Wayne had to walk me through it the first time that I did it. So we can call for action for people to advocate and actually get them to follow through, especially the affected families that have never navigated the site before.
Yeah, totally. Yeah, the Sierra Club provides they have a website, capitalwatch .org, I think. Anyway, the follow the Sierra Club on social media. There's a way to sign up for email updates on their website, sierraclubhawaii.org, I think. Oh, and thanks, Wayne put it in the chat. So these are ways to keep up with the bills, and Sierra Club will be following these bills along with others that are relevant to protecting water resources, and that'll be a good way to, have somebody else do the work for you. But then also can build community with other people who are also following these bills, care about these issues. And
Yeah.
maybe it makes sense at a future CRI meeting, we could, just sort of like walk through the Capitol website and explain to people how to do stuff. We can put that on the list of things to consider. Thanks, Jamie.
Yeah, I follow those sites. Like, I'm good on that. It's just for others that are just getting involved or that have been involved that don't know how, or calls to actions of which representatives to reach out to put that pressure on to them. A lot of people don't get that far in depth, and if we need those bills to go across, maybe just a list posted to the CRI's website or something like that, and then, like you said, walk people through it for a CRI meeting is all. Just want to get more people involved that way.
Yep, good idea. We could do that. Thank you very much, Jamie.
No
Okay,
worries.
we've got Susan Pacola Davis is next in line, and then Tara, is your hand up again, or is that from before?
But Rosalie put in the chat that if you like, oh, for public testimony, Kalamai, I was just thinking that was for the bills. Kalamai, to put a list together for the bills that Jamie was talking about.
Yeah. Okay, we got Susan Pacola Davis and then Elima.
I didn't get a chance to comment on what Ernie was talking about, the swarm team, because I thought I had to wait. I didn't know that I could. Well, anyways, I just want to echo what Ernie said about the swarm team and that meeting on December 10th. What I took away from it was that our personal subject matter experts only had access to the tech memo. And then as they were bringing up their questions and their dialogue, Chris Waldron basically said, well, you didn't have all of the information. So he was trying to negate what they were saying. But on top of that, we know that they withheld the information in order to be able to pull that on the subject matter experts. The other thing that Ernie brought up about JP5 is that their narrative has continued to go back to JP5 and not on total petroleum hydrocarbons or any of the other chemicals that are still in the water. So their distraction now is to keep reiterating JP5, JP5, and I think it's on us to keep on saying, no, we're not talking about JP5. JP5 is already dissolved. It's not there. You're not going to find it anymore. You know, that happens on November 21st through January 1st of 2022. So I would like to see if Ernie's subject matter experts, after they finish reading whatever Chris Waldron added to the information that nobody had, if they have any changes in their perspectives. I thought that the December 10th meeting was one-sided because Ernie and Erwin didn't really get to say very much, and then they had to leave. And we can talk more about it at the Board of Water Supply meeting on Monday. Thank you for letting me speak. I'm not feeling that great.
Oh, feel better soon, Susan. Thank you very much for always being being there for us. And yes, we share your concerns. Okay, we're moving on to Elima, and then after that is Chris. And then we are officially sliding into the public testimony phase of our meeting. So if anybody has any questions, you can either write them in the chat and we can read them out, or you can unmute and raise your hand and we'll unmute and you can say your question. So go ahead, Elima, and then Chris.
So real quick, I just wanted to ask perhaps Wayne or anyone else on our team if maybe we wanted to do when as bills progress through different committees, oftentimes organizations that I've worked with in the past will send out, emails saying, hey, it's time to testify, go ahead and do this and that and whatever. So I don't know if that's something that Wayne folks are already getting ready to do, but maybe people can sign up with Wayne for that purpose of being able to do as Jamie indicated, to be able to submit their testimony. And oftentimes the organizations will make it so easy that you can seamlessly submit that information, so these folks are so technically skilled that they can get that accomplished. So I just wanted to let people know that it's a little easier than we think it might be. It's just a matter of the timing. And then also with regard to getting items through committees, we also would do well to figure out how we can get chair memos to those different chairs and have them hold hearings for them. So I don't know if anybody has prepared a chair memo in the past, but if that's a possibility, we can work on that. Mahalo.
Thank you, Lima. And Wayne confirmed in the chat that Sierra Club will be doing that again this session. So if anyone's interested in receiving those kinds of advocacy emails from the Sierra Club, please go to their website and sign up. And it's there's more information, including the web address, in the chat. Okay, Chris, are you there and ready to speak?
Yeah, I'm here. Sorry.
No worries. Welcome.
Hi.
Hi, nice to
I
see
thought
you.
it was near the public testimony part, but I just wanted to ask a little bit about, since it was on the bills, is there any workshopping that people can do together where we write our own bills to get enough signatures? And mainly, my main concern since the very beginning is that there be legislation of notification to water users, that be more uniform and that be like a state law type of regulation. Because more state regulation is what Hawaii is lacking on, how some of these agencies have gotten around that they're abiding by all laws. So it just needs to be stronger stuff. So I would be interested if others wanted to figure out a way for us to start writing some of our own Red Hill type related inspired bills, to get those in, or who we can work with at the state level to help write those as well. Just an idea. And secondly, I wanted to echo that, yes, I'm completely seeing the Navy try to zero in on language of JP5. So Ernie Lau, you are seeing the same thing. They try to use things like clean as well, like cleaning the stuff, instead of shutdown or closure. So it's really disheartening that it's not just open. So I just wanted to echo that for you.
Yep, I appreciate that. Thank you, Chris.
That's kind of out there.
It's not out there. It's definitely, I think, Red Hills exposed just how large the cracks are between the different kinds of protections we have, both for groundwater and drinking water and regulations on public water systems. And it's our job to figure out how to fill in those cracks so that nobody has to go through this again in the future. So, uniform notice to water users is a very basic thing that you think would already exist. We have introduced bills in the past around like right to know and things like that. So I think we might be able to pull some of that language forward, and then there may be options throughout the session to amend bills to include those kinds of concepts like you're describing, Chris. So we'll keep on keeping on, and there's always next session too. So I think it's important. We've got to. There's so much we need to fix, and we just gotta get started. Yeah. Okay, other questions or comments around bills or anything at all related to Red Hill, water, the military, anything?
I think what Wayne put in the chat is important, that unfortunately today was the cutoff day for introducing bills. But the next time would be when resolutions are to be introduced. And that's a good way to get the legislature aware, Chris, for example, of what you would like to see, would be submitting a resolution, and hopefully it needs to be adopted or passed in both chambers, because otherwise Department of Health, which most likely involved, will not listen to a single chamber resolution. We learned that the hard way. So we got to make sure you have House and Senate. It has to be concurrent resolutions. But that would be your best bet at this late juncture, is to start working on a resolution. I don't know when the cutoff for that is. Wayne, do you know when that might be?
I can look it up. I'll put it in the chat.
Okay, great. It's a good start.
Michelle, you have your hand up?
Yeah, Ernie had mentioned this new administration, and that brought up some fears that came up during President Trump's address on Monday, on Martin Luther King Day. He had mentioned in his speech the words, something along the lines of, we plan to replenish our oil reserves, refilling our oil reserve. So for me, that was very triggering language. Lots of red flags went up in my brain. I feel a letter of concern to the president regarding our issue on that line. And what does exactly that mean and look like? And yeah.
Yeah, I mean, if you would like to draft a letter, and then we can circulate it amongst the CRI members and see who the people can sign on, and we can send it in. I think it's important to develop a relationship with the new administration. It's just the way it is. So here we go. Yep.
Yeah, if I can just say to that effect that Tulsi Gabbard will be undergoing her confirmation hearings next week, Thursday. And that is for, I believe, national intelligence. So if there is any risk that Red Hill might be involved in any of her decision-making, we should, I guess we need to be cognizant that whatever happens on Thursday might affect what's happening at Red Hill.
And Tulsi Gabbard really has been an ally on Red Hill from, before when we were working on after the 2014 release, she, and while she was in Congress, was very helpful in trying to get information out and things like that. So yeah, not all hope is lost. Like Uncle Ernie said, don't give up hope. But keep on keeping on. Be determined. Okay. Any other? I couldn't remember. I saw somebody else's hand. Bill, did you have your hand up? Sorry. No. Okay. All right. All right, so we are at 7:10, and this is the open, open mic session in our meeting. So if there's anybody from the community that would like to say anything related to Red Hill or water protections, this is the time. And otherwise, we can call this meeting early and be the first. Usually we go late, so we're making it for last time. Okay, Wayne has his hand up, and you can also put your stuff in the chat if you would rather not say anything out loud. Go ahead, Wayne.
Yeah, just to let folks know, there will be a press conference on Tuesday at 11 at the state capitol regarding the landfill that's being proposed for above the aquifer in Wahiawa. So folks, yeah, we're thinking about bringing folks out to hold signs like at 10:30. So if you can make it, you can come join us. On Wednesday, the city council will be also hearing a resolution reaffirming their position that we shouldn't put landfills over our drinking water. So I don't anticipate a lot of resistance to that, but that's also another opportunity to, demonstrate to decision makers that people are coming together around protecting water, especially after what happened at Red Hill. So I can put those details in the chat, but yeah, that's all. Thank you.
Thank you very much, Wayne. Yeah, this is a good opportunity to also do announcements. Remind everybody that the Red Hill Health Registry is meeting on Sunday at 11. Information is in the chat, and also we will post it on the CRI website. Any other announcements for the next, week or two?
We may, I'm sorry, we may be having a water drop soon with the Campbell students. So I'm working with them on that, and that would probably be by February, we'll have a water drop in Eva.
Excellent. Thank you, Helene, for doing that. And that's with Kalakui Mutual Aid?
No, this is with Kalahui, Hawaii.
Oh, thank you. Right on. And then we are currently temporarily to be determined holding the date for the next meeting of the CRI with the Navy February 6th. The Navy has not confirmed, so we haven't really announced it yet, but we are aiming for that date, which is, not long from now. Hopefully they will finalize and confirm that date with us as soon as possible. And then also want to remind everyone that we have an opening on the CRI, and it's possible to apply. We have a Google form linked in the agenda and also in the chat. If anybody would like to join the Bad News Bears of Community Outreach, we have an opening. Thank you. Let's see. Anything else? This is your chance. 1, 2, 3, 15 seconds of fame. Here we go. All right. Well, Happy New Year, everybody. Congratulations. We've made it this far. And yeah, thank you. Oh, that reminds me. I want to thank Olelo. So Olelo Public Access Television is perhaps the most important element of this whole outreach effort. And but for Olelo, it would be infinitely harder for the public to get information out. So, and they have just been so professional and so accommodating. I'm so grateful for them. They are a nonprofit. If you find it in your heart as you're paying taxes that you want to maybe reduce your tax burden, you can give a donation to Olelo. They need all the funds and support that they can get. There's probably going to be opportunities to express support for them at the legislature and at city council. So when those opportunities come up, I think, if we all benefit from this service, and we should show up to support them every chance we get. And on that, thank you very much, Olelo team. The open seat is for an at-large member. So anybody who is living on Oahu and drinking water is eligible to fill that seat. And applications are due by February 26th. So you have 1 month. And we'll be circulating this on social media and, word of mouth. So keep a lookout. And thanks to Rosalie and Madison, who are like our wizards behind the curtain, keeping us on it all the time and making sure we say all the things we're supposed to say. We're in the right place at the right time. So thank you very much to them and to all of the many people who helped to make the Community Representation Initiative successful. We really appreciate it. Anything else? All right, lots of hearts all around. Take care. Happy New Year, everybody. Bye.
Aloha, mahalo.
Aloha.
Aloha.
Aloha.